Hi, I'm Dr. Kyle Chapple. I'm an endovascular neurosurgeon. I'm a partner at Atlantic Neurosurgical Specialists, and I treat patients here at Overlook Medical Center. An aneurysm of the brain, or a brain aneurysm, essentially is a weakness in the side wall of an artery in the brain. And with the blood pressure within the artery, that weakness in the side wall starts to expand and get bigger and bigger, kind of like a balloon. And as that balloon gets bigger and inflates with the blood pressure of the blood inside, that balloon can thin and rupture. And when that rupture happens, blood goes out into the brain and can cause a whole host of problems with the central nervous system. So Sue Moeller, she's a patient of mine that's unknown to her or anyone else. She had an aneurysm in her brain. And during the normal course of her day, that aneurysm got big enough, the wall got thin enough, the pressure within it built up, and it ruptured. And blood came out of that aneurysm. Blood came out of that aneurysm and into her brain, and that caused a lot of problems for her, both her neurologic system as well as her neurologic function. So from that aneurysm, when that blood came out, they saw that at an outside hospital. They called us, and she got transferred over to Overlook, and then we went to work. So here's a video of how we treat aneurysms from an endovascular perspective here at Overlook. So this is a zoom-in view of a very small aneurysm. That aneurysm that you're looking at is probably in the order of 3 millimeters or so in real life. And so what happens is we guide a small microcatheter from an access point in the upper leg. We guide it through that artery up. We bypass the heart. Then we pass that microcatheter up into the brain, inside of that little 3 millimeter aneurysm, or whatever size that aneurysm is. When we get that microcatheter into the aneurysm, we start to deploy coils. These coils are specially made out of platinum and some other very soft materials, and the object is to get that coil to fill up the entire space of the inside of that aneurysm and occupy the inside of that aneurysm, but not have any coils or any materials in the parent vessel that that aneurysm arises from. The issue is you want the blood flow to stop inside of the aneurysm, but you cannot interrupt the blood flow in the parent vessel. If you were to interrupt the blood flow in the parent vessel, it could cause a stroke downstream. So through that microcatheter, we pass these coils, one after another, until we fill up the aneurysm, which is what you're looking at right now, where the aneurysm is almost completely occupied with these platinum coils. The coils are detached, they stay in there, they're permanent, and as soon as the coils fill up that aneurysm, the microcatheter is withdrawn and those coils stay and they shut the aneurysm down. So signs and symptoms of a ruptured aneurysm can be anything from the worst headache of your life to clinical symptoms of neurologic decline, including paralysis, deep coma, and even death. So when Sue Moeller came in, she had a ruptured aneurysm in her brain, and she was a very high grade in a very severe clinical state. She was very sick. We were able to treat that aneurysm from the inside. We coiled the aneurysm off, shut down the blood flow to the aneurysm. We were able to maintain the blood flow to the other important arteries around. And then she went off to the neurointensive care unit. She was in there for days to weeks. She was being worked on by myself and the other team of clinical neurospecialists here at Overlook in the neurointensive care unit. And eventually, because she's so strong and she was such a tough fighter, she made a full recovery and she's doing great today.